All right, this is Cindy again. I'm back with my 1 week point from having had rotator cuff surgery, and I wanted to talk a little bit about pain control. Um, I've had a pretty good experience so far. My pain has been mostly 1 or 2, sometimes 3 or 4. It hasn't been terrible. Um, I will say that I had less information from my medical people than I wanted, and I got the information I needed, but I basically had to to really ask a lot of questions. There's a lot of stuff that wasn't offered to me, so I want to offer you what it was that I had to find out. So first of all, so there's a pain catheter that my doctor decided that he was going to use with me, which is basically, there is a reservoir of numbing medicine, kind of like Novocaine. They do an ultrasound to determine the position of the nerve that serves the thumb of the operative arm. Then they thread a tiny, tiny catheter, like, like fishing line. I mean, it's very, very small, almost like a thin picture wire, in under the skin to the site of the base of that nerve, and then they apply the numbing medicine right there. So they're going to give a kind of a heavy dose of it just out of the surgery, and that's kind of like a 24-hour, so to speak, nerve block. And sometimes you get just that. And then if you're like me, they decide, oh, well, we want to continue that. So they gave me a nerve block, like a pain catheter, which has a little pump, and it continues to deliver that medicine for 3 days. It gives you a continuous dose, and you can, on demand, like every 30 minutes if you need to, you can increase the dose. If you go through a rough spot, like I did when the first 24-hour dose that they gave just after the surgery wore off, then I was able to give myself a little bit more to help me through. So my literature from the doctor's office said, the pain catheter will come out after 3 days. And finally, after some time, I said, well, who takes it out? I mean, does it fall out? Does it auto-eject? What's happening? They're like, oh, well, family member or a friend, might take it out, or sometimes even my patients take it out. I'm like, my cat's not going to help me with this, and this is my first surgery. I don't think I'm doing it. So I hired a nurse to help me, and to get the catheter out, that was really a smart decision. And I got my nurse through the home health care agency that I hired to get my 24-hour help for those first few days. So, so my nurse came, and anyway, so I wanted to plan my pain management, because I realized once that pump is gone, I'm going to have additional pain. So, because there's an on-demand feature, I thought, well, I'll have it taken out before the pump is completely empty, and I'll give myself a dose right before it gets pulled. But I wasn't really sure what else, so I called the nurse and I said, hey, here's my situation, how do I plan? And she said, well, people normally start taking ibuprofen when they lose that pump. And I thought, oh, because I'd heard you're supposed to alternate ibuprofen and Tylenol. Not that this was in any of my materials, this was just word of mouth. So I thought, okay, that's cool. So I took some ibuprofen, a couple of hours before my time was, so that I would be right at the point where I could alternate it with my Tylenol and hydrocodone dose that I was taking every 6 hours. Anyway, so the nurse gets here, and she was super great. So I'd given myself the numbing, I gave myself the numbing medicine right when she got here. Then she took the Band-Aids off, and the stuff is like, they tape all the stuff down to your neck and stuff, and the entry points at your neck. And most of the discomfort was really in her removing the tape and stuff, but there's a lot of it, and it goes kind of back here. It would really have been hard for me to do myself. So get somebody to help me with it. She took it all out, and then once she took all of that out, I guess you just lift and it comes out. Now that wire was 3.5 inches long or something. It's not a short little thing under your skin. I would hesitate to ask a family member or a friend, but some folks might like doing it, so you just don't know. But anyway, that came out, and that part didn't hurt at all, like the wire pulling, not a problem. She just put a Band-Aid on it, it's good. The other thing was that my discharge order said I could change the dressing after 3 days, and I could shower after 3 days. So it's 3 days. And I still got the original surgical dressing on. So again, there's a lot of stuff taped. I can't get to it. It's just too much. So I asked the nurse to to help me with that. So she removed the dressing. Everything was pretty, like nothing was continuing to leak or anything, so I didn't really need any new dressing. And I have some steri strips there that will stay on until they fall off in I understand, a few days. So anyway, so I was on there with my steri strips, and so you got the dressing off. That's great. So since I had her there and I had the home health care person there, we decided, like, I wanted to try to shower. And I have to say, I was really scared because I had not had my arm out of the sling. I could not feel my arm. So, and I could not move my arm. So I had to kind of like let the arm down using my good hand. And I really didn't want to create a problem or harm because I was just 3 days out of surgery. So they helped me shower. I have a shower wand, the kind you like can detach and use that. Really, you should have one of those if you're having the surgery. Get one if you don't have one now. Another thing that I have found that's super helpful is I got a bath brush that is, so it's actually one of those kind of plastic puffs that you use with liquid soap, and I got some liquid bath soap that I like. So I got the puff, and it's on this arm that's kind of, I'll do my arm kind of like its shape, so it's got a kind of a kink in it, and it's got the puff. What's really cool about the shape is I can set that down, I can pump the soap onto it, and then I can reach all of my back. I can actually use it to reach like the bicep of my non-operative arm, which is so cool because I can't do that with my other arm. So it really will get you pretty much everywhere you need to go in terms of getting the soap. So yeah, they helped me out with that. I have a shower chair that I borrowed from a friend. I used it that first day. It was really good. You might feel a little dizzy, if you're on like a codeine kind of thing, which I was or am. Yeah, it doesn't make you feel great. So that's nice to be able to sit down. But anyway, so, then we got me showered, and then I got my arm back in the sling and got myself some clothes, fresh clothes, yay. And that was great. And then by 2 days later, I was like comfortable, like doing that all by myself, alone in the house, washing my hair, the whole thing. Marvelous feeling, I have to say. So that's that. So the other piece about pain management that I wanted to talk to is that in the literature, they say, oh, well, you should, most people have weaned from the narcotics onto Tylenol in like 5 to 7 days, like mostly weaned, right? And the only information I'd really gotten about that was like one time a nurse said, well, you should just like have longer and longer times between doses. And I thought, well, I'm supposed to be doing this every 6 hours. How does that work? Well, as it turns out, how it really works is as soon as you're feeling like your pain is under control, after you've gotten the pain pump out and you've given yourself, there's a little bump in that pain, and I ended up taking a little bit extra of the narcotic just to handle that. Not very much, just like a half a tablet twice afterwards, and everything kind of calmed down. Once you get to that point, I was ready to be away from the hydrocodone because it doesn't make me feel good. It messes with your digestion. You will need, like that stool softener that the doctor says, you need it. Consider getting Senecot, which is like a natural laxative. It helps a lot. Prune juice, I could go on, but the point is you want to be comfortable, right? So all those things, like I'm doing fine, but the narcotics will constipate you. So anyway, so I just am now like, I took a dose with the hydrocodone earlier today, but it was my first dose in 18 hours. So now I'm like 2 doses of Tylenol in between. If things go well in the night, in the morning, I may wait until tomorrow and take one final dose, but you just kind of titrate off slowly. And then and substitute the Tylenol, and then you're every 3 hours ibuprofen, every 3 hours the Tylenol. The really great thing will be you stop having to eat every 3 hours, because with the codeine, I had to have something on my stomach for the codeine, had to have something on my stomach for the ibuprofen. That's hard. It's hard to get something on your stomach, and then you don't even feel like it. You have to kind of scale back your meals. But if I'm just on the Tylenol, then I don't have to have something on my stomach. So it lessens that, like, oh gosh, what is it that I need to eat in order for my stomach to not be queasy? I haven't been queasy the whole time, but I think it's because of my management. So let's see if there's anything else I want to tell you. Not about pain management, I guess just mostly about readiness. I will say that, watch the videos, read blogs, invest in things that you think will really be helpful to you. There are a lot of people have a lot of recommendations. Right now I'm doing this video with a phone stand. So my phone stand is clipped to a coffee table in the living room. I can move it around. It's super great because then I can talk and Zoom or whatever hands-free. Very nice when you only have one operative hand or one operable hand. The other thing is in the kitchen, there is there's a material called, I think it's called Dicem. And what it is, it's a material that comes in a roll. It's a tacky material. In my case, I got a roll that was about maybe 36 inches or something, and it's a foot wide. And I had my home health care people, when they were here, cut the roll in two pieces, and they put it on my island. What is super cool with this is you can open jars. Like a fresh jar, like from the, like a jar of applesauce or something like that. You might need a neighbor to help you with that. But let's say you have one of those pill bottles that's childproof and you have to push down to turn it. When you put that on that tacky material, it holds it in place. And so you can actually push and turn without the bottle turning, which means you can open your medicine bottles. So anyway, so thank you so much for joining me here. I'm indebted to my many acquaintances and the many folks on the internet that have been helping me, and I'll check back in at the 2-week mark and let you know what I've learned in the next 2 weeks, or the next week, but I'm doing well, and I'm hoping what I've shared is helpful to you. All right, take care.